You're listening to Age to Perfection, where we redefine aging, celebrate every milestone, and empower women to thrive at every age. We're so grateful to have you as part of our community. Don't forget to hit that subscribe button so you never miss another episode. Cheers to being aged to perfection.
Ready?
Yes, ma'am.
I don't know if the world is ready for us, but... Hi, everyone, and welcome back to Age to Perfection with Dr. Patel. And today we are talking about all things sex. And back by popular demand, we have Brent. You guys, we did an episode earlier and you loved the male perspective. You loved that it was someone not just in the medical industry, but that someone that was in the aesthetic industry too. So we thought, let's add the male perspective to that. And let's talk about sex. And to break it down, today we picked an 1858 Paso Robles in their cap. The reason I picked this, they labeled it 1858 because that is the year that the first grapes for commercial production were planted in Paso Robles. So they started all of this way back when. And just like this bottle, our topic is as old as time. Listen, the world's oldest, profession. We know what it is. So,
absolutely.
That being said, this whole industry that we are in is rooted on our desire to look and feel sexy, right? At the end of the day, we want to look good. Why do we want to look good? We want to be desirable and we want to look and feel sexy. We want to be appealing, right? So what exactly does that entail? What does sexuality entail? So I thought we could sit down and break it down on what is desire, what is performance, and what is just looking good naked, right? I think that's half the battle. So I love that we can have an open and honest discussion. So let me start this podcast first and foremost by apologizing to our significant others.
Sorry.
We don't know what information will be coming out of our mouths. So we apologize ahead of time if it's TMI. Okay. Sex starts with desire. We learn in our medical school education, and I don't know if I'm sure when you guys did reproduction, we always learn that the desire for sex should never go away. Even if you're 90 years old, it should never, ever, ever go away, right? Picasso had kids well into his late 80s. Mm-hmm. So it's there. I feel like that even though we learn it in medical school, that I don't know that that's necessarily true of real life. And I know as a female, I can tell you there's definitely a period in life where that sex drive just takes. We don't want it. We don't want to talk about it. We don't want to look at you. We don't want to touch you. We just don't want to. Does that happen for guys?
I think it all depends, and it depends on how busy they are. So going back to what you were just saying about, there's a period of time, a lot of that comes when kids come along, when work gets busy, and that is the priority at the time. Or going back, when the kids are the priority with sports and things like that. Your mindset is elsewhere. You prioritize those activities before you do your significant other. And so the best advice I can give with that, not to jump right to the conclusion or the answer, but I think really and truly is, you got to date your spouse. You got to keep things going. You actually have to put a active effort into it so that it doesn't get pushed aside and it's the last thing that y'all want to do. I actually saw, speaking of podcasts, I was watching a podcast and it was funny. It was just a clip from it. And it was basically saying when people go out on a date with their husbands, is the most common thing is to wait to the end of the night when you get home to have sex. And this person was trying to say, you should do it before you go out. They were like, you should. Why? They were like, because then you're not tired. Because they're like, how many times you go out and you eat too much? You come home and you drink too much. You come home, you're bloated, you're gassy, you're tired. It's the last thing you want to do. And she goes, I make it a priority to do it right before we go out. And that way there's no pressure. Everyone's feeling good and it's kind of exciting.
Everyone's in a good mood.
I was dying. I was like, I actually kind of like this. Sent it to my wife. I was like, what do you think? No response, of course.
Okay, but in her defense, she's still in the thick of the baby things, okay?
This is true. Yeah, this is true.
So I will tell you, for women, we can go year, 2 years, 3 years without sex and be just fine. Is there a limit to guys? How long, like, before it okay, let me tell you this. Not about how long before you would get cranky. We all know it takes a very short amount of time for you guys to get cranky. Is there a physiologic, like, do you feel like you don't perform in the gym as well sometimes if it's been too long? Do you feel like, because, there's studies that show that if if men don't have that release, it actually affects their energy levels, their sleep, all of it.
Okay. I haven't seen that study. I don't necessarily think that's the case. I know that it does help, relaxing and things like that. It kind of relieves stress. Big thing with me is I like affection. That's kind of, I'm all the love language and stuff, like I'm signs of affection. So I use touch and sex and things like that, and it makes me feel closer to you. So that's where I'm at on that. So that means a lot to me. Yeah. Makes me feel closer in my relationship to my wife. Yeah. But no, I mean, you could go. I don't think it affects the gym and stuff like that.
I've actually even had a couple of our patients, like our hormone patients, come in and say, obviously, when they get on medication, things start to all improve better.
Absolutely.
So I don't know if that's the case, but a lot of times I have had patients that say, like, when they would go so long without it, it would affect their gym performance. It would affect their sleep. And I mean, if you think about it, it makes sense. It's the dopamine rush, right? Like,
I think it would make me want to work out harder.
Well, don't they say athletes?
So is
it true? Athletes don't have sex before a big game or something like that?
So yeah, it's supposed to kind of build up aggression and stuff like that.
See?
So when because you're more relaxed afterwards and stuff like that, so it's supposed to be there. But then there's also the point of view is that, like, professional athletes or Olympic level athletes, people who are doing excessive amounts of training, really kind of lose the desire because they expend all that energy and stuff that they're just like, I can do with it or without it. So there's kind of a different way to look at it. But the big thing is if someone is leading into a different conversation, is if someone is performing normally, they don't have any issues or anything like that, then with guys, if the wind's blowing the right way, then
they'll be happy.
They're ready to go.
Quick question and a side topic. I didn't even have this in my notes, but I feel like now we hear a lot more about asexuality, even in men. There's a lot of discussion now about gender,
the identity and stuff
and things like that, and there is now a conversation about men that are asexual, meaning they don't find men or women attractive. They actually don't find anybody attractive.
Okay.
And there's more and more of a significance. And to me, as I hear about these things, and you look at puberty in our kids. Mm-hmm. And you have kids, different age ranges. You've seen them grow. My 11-year-old is already hitting puberty. Mm-hmm. And I don't think I ever saw that growing up. So I also don't know how much of the hormones in our food is actually affecting our long-term sexuality.
Oh, I think it's playing a big part in it, for sure.
In what sense?
In that it's well, number one is causing, I do think it has something to do with, of course I don't have the proof, but I think it is, theoretically, and just knowing what I know.
This is a podcast. We can go based on clinical experience.
Kids are hitting puberty earlier.
Yes.
And that's, if they are delayed, there's not very many anymore. Most of them are starting at like 11 when it used to be like 13.
13, 14.
Yeah, yes. It was the most common age. And so, they're hitting it.
Yeah, I went to the pediatrician. I was like, wait, is this normal?
Yeah, and they're seeing that now. I think a lot of it has to do with hormones in animals that they're using and things like that. It ends up in the meats and then it's being, cross-contaminated and transferred over to kids.
Even our junk food, even our chips, our cookies, all of it's enhanced somehow. Mm-hmm. And people don't realize it. It's not just the hormones in the food, but all the additives are also adding to the changes that we're seeing. Even long-term health benefits, right? Like the age of cancer screening used to be 50 when I took my board exams. Mm-hmm. It is no longer that. It is now 45.
Yes. And so, the thing to go along with that as well is environmental plus the things that we're eating and stuff. Like men are getting diagnosed with low testosterone in their 30s now.
Yes.
As versus it was no, as for the longest time it really wasn't an issue in my parents or in my grandparents. They were good to go the whole life.
Okay, so if we're going to go on this tangent, let me tell you one more thing. And this actually is a proven study. So obviously fertility doctors, fertility treatments have gotten popular over the last 30 years, right? More and more of us are having to seek out those services. And so they actually did a analysis on sperm count. And they have noticed a significant decrease in the average sperm count.
I saw that study, yes.
Yes. It's crazy. And that's just in the last 30 years, you guys. We're not talking about our parents' generation versus our kids. We're talking about ours, like just one. And it's affecting all of us, right? So that begs the question then, how much further, how many more other things are we going to discover as we go along, right?
Absolutely.
Okay, so then let's talk about sex in the two. We're psychological and physiological is I think how I kind of break it up. I think female sexuality starts to decrease after kids. Like our hormones change, our bodies change. We no longer feel desirable. We're tired all the time. So for us, I feel like it's both psychological and physiological, right? Because our body changes. We don't like the way our bodies look. We don't like the way anything fits. Things just, if I don't want to look at myself in the mirror, what makes you think that I want anybody else, including my spouse, to look at me?
Right.
I think that plays a big, so I'm gonna ask you a hard question.
Okay.
Earmuffs, Aline. Does your partner's body changes reflect your sexual drive?
Absolutely not.
No,
not me.
I don't want the Celine answer. I want the actual.
No, that's not a loaded question. I don't think at all. But no, because
feel free to reference the locker room talks.
Yeah, no, I mean, for instance, if I'm like me being married, or in a scenario with someone being married, yeah, if I'm truly, I do truly love my wife, in any scenario that you're in love with your wife, like you just want that attention, that affection, and their looks, no matter what. Yeah, that doesn't matter. Now, of course,
you're not everybody, so give me a general.
Yeah, if you
and Zeline's relationship is not everybody.
I would think that of course everyone wants to look at someone that's aesthetically pleasing. Now you can't compare that to like a swimsuit model or something like that. It's what you find attractive.
I think women always wonder how much of that does it play? I feel like in a guy's head, that's a very like 80%, like looks is an 80% driver. Whether you have a committed, deep emotional bond or not. Correct me if I'm wrong.
I actually don't feel that way.
Okay.
Yeah, no, I really feel
that's why I want a guy's perspective.
Yeah, no, so
my husband's going to lie to me. He's not going to tell me the truth.
If I wasn't married and I'm dating, then yes, the physical appearance plays a big part of it, and who I'm attracted to, and then it becomes the bond after that takes over.
Got it.
But for instance, Celine, my wife, she is absolutely gorgeous and beautiful in shape and all that good stuff, but my feelings wouldn't change. And in fact, when she was pregnant, 30 pounds, and she gained weight, and I still thought she was absolutely beautiful, still wanted to have sex with her. Okay. Nothing changed whatsoever. So I think it's a different aspect of at what point in time you're at, whether you're single, dating, looking for something like that. Where your
relationship bond is.
Exactly.
The stronger the bond, human beings, we move past the
absolutely
physical and more into the psychological.
Absolutely. But on the hindsight, not to be the pompous guy here, but everybody wants, who wouldn't want their spouse to be in fantastic shape? Like if you could snap your fingers, because if she wanted it and you wanted it and you could change that, of course, it's always fun. So.
Oh, I agree. But from a female's perspective, we are more emotionally driven creatures.
Right.
We are not visual creatures. Men are visual creatures. So I could have dated a fat, bald guy, and if he made me laugh and cherished me and, loved me as I am, I think I would be just as much in love with him as I am with my husband who looks, has a six pack at 45. Like
fantastic shape. Yeah.
Fantastic shape. I'm lucky. But I think, again, even if he wasn't, he could let himself go tomorrow. And I don't think it would change at all. I don't think my attraction would change.
That's good.
But I think that's how women are.
Absolutely. I agree.
Okay. Now let's talk about performance. Now, as we get older, performance gets harder and harder and harder. In my medical training, the book answer is that you see andropause around 45, 50, kind of like, and in fact, in men, a little bit later. Andropause is essentially, for those of you who don't know, men go through menopause as well. It's called andropause, and this is when the testosterone that's already been tanking takes the even bigger deep dive. And then I don't know, you tell me when you talk about from a male's perspective, because I can, as a physician, tell you what I prescribe my patients, but I am not a man. I'm not going through it. So when you talk about performance for a man, performance in the bedroom, what do you look at? What are the kind of the checklists in your mind? Like, am I here? Am I not? What are some options? Like, how do you approach that?
So what I can give you some good advice on the male perspective of how to be successful in the bedroom. It could be physiologically or psychologically, or sometimes both.
Yes.
So let's say you are a young man and everything is performing good, and you're like, how do I get my wife to have more sex with me? So I'm going to say the first thing, and this can do with physiological as well, is you got to take care of yourself. You got to have confidence. You got to be willing to take your clothes off with the lights on.
Yes.
Not always want the lights off. So get in the gym, lift weights, take care of your diet. Don't drink too much alcohol. Some is good, but just don't overdo it, because that can affect performance
especially
as well.
On date night.
Exactly. And then have your confidence, because basically, when's the last time you saw your toes? Because if you can't see your toes, you can't see something else. So you want to have, be in the best shape that you can. You want to feel confident when you take your clothes off that you're like, yes, you get to see me, you get to be with me, and so on and so forth. So I think it starts there with the basis. The second thing is let's say that it's not working so well, that you're not able to achieve an erection or maintain one for long enough to have sex, which is a very common thing that is happening now in people's 30s and 40s. So, I've been around this for about 15 years in my training as a nurse practitioner. But then it's also it's only been the last 5 years that this has corrected itself. So, let's say you're not able to achieve an erection. It's frustrating you. Your wife is understanding, but you still know it's kind of frustrating because you want to be intimate with her and have sex. So you're like, all right, I'm going to go to the doctor. And so I've experienced this as the not physician, but the nurse practitioner, the practitioner. So they come in and they're like, hey doc, I'm erectile dysfunction. It's not working. What do I need to do? So up until the last couple, maybe 3 years, they were always prescribing Viagra and Cialis.
Yep.
And that's really, really not the root of the problem. That's just a quick fix if you just want to do that and wait, 2 hours or whatever.
What is the root of the problem, Brent?
So, until the last maybe 2 or 3 years, is people now are understanding that a lot of it comes from testosterone.
Yes.
And that it's not just that quick fix, throw some pills at it and you're good every time you do it. Well, you can do that forever. Those pills stop working after a while. If you're doing it on a regular basis, they're not as effective. So now they're checking testosterone levels. I remember when I first started 15 years ago, everyone was scared as hell to check a testosterone level.
Yep.
They didn't want anything to do with it.
Yep.
Not only from the side effects, but they didn't want to prescribe it. They were like, oh, hell no.
Because we were always taught to be afraid of it,
100%. Right? But now all these studies came out that are showing that it's so beneficial for you. And everything
we've been
they
doing
thought.
it for over 10 years, but yes.
Absolutely. So, so now, get a testosterone level. We're seeing now in 30s that more and more of these young men that are having issues have low testosterone. So that's the number one thing, is get tested if you have a problem. Don't just start throwing pills at it or go on. They have all these advertisements on TV now with, I don't want to throw any names out there, but Roe, Hims and Hers. And they're like, here's some Viagra, Cialis, and now they have all these combo products That's not really the answer. Maybe in the short term until you can get in to see a doctor. But get your levels drawn. If you need your testosterone replaced, get it replaced to normal. You're not doing anything you shouldn't do. But that's going to increase sex drive, which, guys, it's typically not the problem. They want to do it, they just can't. But it's going to help fix those issues. Now, if that gets replaced and there's still issues, then you have to look at maybe circulation. That's a whole different route that you have to go into. Or psychological. Are you getting anxious about it? Are you drinking too much? Are you you have to kind of look at the whole approach to it. But that's kind of what I say is I would start looking at your
confidence first,
absolutely,
not pills first.
Absolutely. Looking at your confidence, looking at how in shape are you. Your wife wants to want you to, even though they're emotionally driven animals. Who doesn't want to look at a nice fit body?
Well, and okay, so let's talk about testosterone. So we have a huge patient population. We've been replacing testosterone for many, many, many years. One thing I didn't realize, and I've learned over the years, is it's not just replacing the testosterone. It's also about how that testosterone is being absorbed and used. So funny enough, I had a patient like 4 or 5 years ago, and the testosterone level was good. We replaced it. We got him physiologically optimal. And he was like, I can get an erection, but I cannot maintain it. And he's like, I don't want to increase my testosterone level because I'm happy where I am. I also don't want to keep taking Cialis or Viagra, like you said. Right. And believe it or not, we started him on the HRTT, the multivitamin, that is actually supposed to help you absorb that testosterone and utilize it in the best way possible. So, guys, I don't think most of you realize this. It's not just those of us that have been doing hormone replacement for many years. We've moved on. I know the rest of the world is just now catching up, but we have moved on from just let me give you a little testosterone, a little progesterone, a little estrogen. We are doing multivitamins with it. We are adding it with peptides. We're combining it with GLP. There is, like you said, it has to be a full-on approach. And so just adding a multivitamin that was specifically designed for testosterone patients to help them absorb that testosterone knocked away that problem of being able to maintain an erection. And he was the one who taught me, like, everybody needs these pills. Now I throw those pills at everybody, right? But you are correct. I mean, and I will say, back to your point, think back to high school. There was always that guy that was popular, and you were like, you are like a 3 out of a 10. How are you so popular and so desirable? But it's the confidence.
Absolutely.
Those are the boys that walked into the classroom, knew I'm the shit and I'm going to make everybody laugh. And that's just it. And so you're right. It starts with confidence. But I don't think it's just for men. I think even women. Okay. I think
my question for you is, sorry, Zelene, but how do I fix my wife? How do I get her to have sex with me more often? So I need a woman's perspective.
Okay. Specifically for Zelene, just let her sleep. Like, she needs sleep in life. Women can't perform if we don't have sleep. So sleep first and foremost. But actually, the FDA just dropped a medication called Addyi for women. It is the female Viagra. It is still very brand new. And so the jury is still out as far as how much does it help. And I think Addyi will be great for the women that have a chemical imbalance. And that's what keeps them from achieving an orgasm. But I think that's a very, very small percentage of the population. And so for me, I think for women, it does start with looks. Like, if I look good, then I know I'm desirable. The thing is, I don't want my husband to desire me. I need to find myself desirable. Makes sense. And for women, that's just it. Like, we don't care if 20 guys hit on us. If I'm still stuck on, the one fat pocket that I have on my waist, 20 guys can hit on me and I will still be focused on the one fat pocket in my waist. And the good thing, and I feel like now the conversation is changing, that just because you're a mother does not mean you have to have a mom's body.
Oh, absolutely not. Yeah.
You are allowed to go do things. You are allowed to go have someone tell you how to take care of that body. You are allowed to get on medication to help you lose that 20 extra pounds that is pregnancy weight. And guys, you should do it guilt-free. You grew an entire human being. It is okay to get on a little bit of GLP-1s for about 6 to 8 months to help you lose some of that pregnancy weight, because we know it'll get you back in the gym faster. It'll get you feeling like yourself better. You'll be a better mom because of it. You'll sleep better because of it. Your metabolism will be better because of it. So to me, I feel like we're always taught, and it's always ingrained, that everybody else first. If I have one message on how to get your wife to be more, make sure she's taking care of herself.
100%.
If she's too busy taking care of the kids and you and everything else, she's not thinking about sex. And if the sex is not on her brain, it's not going to happen ever. The other thing, like you said, is testosterone. I can't tell you how many times guys come in and be like, I'm so glad you fixed me. That's great. Thank you so much. Now fix my wife. Or many, many times it actually is the opposite, where my females are now on progesterone and estrogen and testosterone.
Oh, yeah.
And they're like, well, I kind of feel like a, college student again. Now I need my husband to be fixed. And which goes back to my whole point that medicine may teach us that sex drive should be there for the rest of life, but it's not.
Right.
It's
Absolutely.
not. And life gets kind of in the way of that, right?
Well, it does. One of the things as you look at the gap is when professional workforce kids and stuff like that. So you have this teenage into your 20s, everybody's horny.
Yes.
And then kids and job become the priority, and then
Nobody's
it
horny.
goes down. And then I don't know if you learned this in school, but it was always, if I found it very funny, is that nursing homes are like college dorms.
Yes, they
like,
are.
It's just it literally is a bunch of old people sneaking into each other's rooms having sex. There's a proven fact that the STD rates in nursing homes is equivalent to like college.
Yes.
So that proves it doesn't go away. It's just where the prioritization is in life. So lesson be learned to prioritize each other.
Well, what age should you pay attention to that priority? So prime example, right? We always said, take your dad, for example, and take you. I've met Brent's dad. He's so cute, by the way, you guys. And they look very, very similar. But dad has a different body makeup than you do. Dad's got the dad bod.
Yes.
You do not. Did your dad at your age have the dad bod?
No, so he's 78. I don't know if you know, that. Yeah, I think he looks fantastic.
He looks amazing.
But he doesn't lift weights. He plays like pickleball, and he played like really competitive tennis, like did all the sports and stuff like that. But the priority has never been on like weightlifting and building muscle. But I don't think any of his friends did either. No, that was just in that age group. It was, unless you were like a football player or a bodybuilder.
I think right now is the first time in history where we have all, as group collective, decided, no, we want to look good, we want to feel good, and I mean, take it good or bad, but we have social media to thank for that.
No, absolutely. I find it funny as well. So I've always been an avid gym goer. Like I've always lifted weights since I was like 13. And I still remember when I was in high school, if you weren't sport specific, like football, no one lifted weights.
Nobody was there.
And then when season was over, none of them wanted to lift weights. But I just kind of got addicted to it and kept going. But what's funny now is like my sons who are, 18, 19, all of their friends are in phenomenal shape.
Yep.
Some of them are competing in like bodybuilding contests. And I'm like, are they playing sports? No, they're in the gym. They want to look good, feel good. And they know, they like how it makes them feel and look. And I'm like, well, that's amazing. I love it.
Well, walk into your Lifetime, walk into your 24-hour fitness, walk into any of the new gyms now. Had you gone, forget our parents' generation, had you even gone 20 years ago, I don't think you would have seen the population.
Oh, no.
Or the sheer number of bodies
right
in the gym that you do now, right?
Absolutely.
But I also feel like the flip side of that coin, speaking of, for women, that also adds an extra stress to us too, right? To get back into that shape, to get back after that baby, because now everybody's back after that baby. But now we have avenues and ways to do that.
Absolutely.
We have GLP-1s, we have body contouring, so, okay, let's get back to weightlifting.
Sorry.
For the dad bod. Now we have muscle stimulation.
Yes.
Because I'm sorry, that hour in the gym when you were in college does not equate to an hour in the gym today. Now that's more like 3 hours in the gym.
Right. No,
And
absolutely.
you had 3 hours back then.
Right.
You just didn't need it. Now you don't have 3 hours, but you need it. Where do you think the role of all of these will play? Do you think people will get more and more into it, or you think?
So I'm a huge believer in the muscle stimulation, and just from my own experience. And so
Tell me about your experience.
Well, so I did join a gym at one point called Body 20 for a short stint. It actually closed here in town, so I didn't get to like keep going to it or not. But before that was the Flex.
Yep.
Yeah. And so I didn't use it for muscle stimulation for like biceps, triceps, chest, and things like that. I did it for my abs and low back and obliques.
Because that at your age is the hardest to keep.
Yes. And
Your buys will grow, your abs will
I
not.
still remember I always did abs some, but I've actually been fortunate enough that my abs have been visible for a while, but they were never really functioning like they should.
Okay.
And I still remember after the first time I did Flex that you guys had talked me into doing it here. And I went out that night with Zelene, and I remember we were dancing, and she like touched my stomach with her finger, and she was like, "What in the hell?" She was like, "Are you flexing?" And I'm like, "No." And literally, I touched my stomach, and it literally was like just completely tensed up,
Yeah.
like rock hard. All my back pain went away that I've
Yeah.
had, and it looks amazing. I was so excited. It actually developed the muscles the few times that I did it.
Yeah.
But then I ended up joining. There was a gym, Body 20,
Body 20, yep.
and that's where you put on
That's
a
why I said
suit.
muscle stimulation in general.
Yeah, you put on a suit and you go through a 20-minute workout, and that I actually put on 10 pounds in 6 weeks because
muscle weight?
Of muscle
Oh,
weight
wow.
because it actually just went away a month ago, and I haven't done it in about 3 months because it closed.
Let's go hop on the Flex.
It developed muscles that I was not activating. Like my shoulders
Yeah.
weren't activating like they should. My glutes.
We don't realize how
And-
many accessory muscles that we
Yeah.
have that we don't ever pay attention to.
and it changed my body completely when I was doing it. So I'm a huge fan of it. I think if you've got the time and the money to be able to do that, it's well worth it. 100%. It will take hours out of your exercise in the gym. Yeah.
Yeah. And so I think that's a great way to conclude, in the sense that yes, now we have more added pressure to perform. We have more added pressure to psychologically look good. But now we have cheat codes.
Mm-hmm.
We
Absolutely.
have not just one. We don't have just Viagra. We don't have just Cialis. And we don't have just stuff for men.
Mm-hmm.
You know, I mean, back in the day, we were doing penile enhancements. And you asked me if we did fillers.
Yeah, I had a patient ask if you did fillers in the penis. Yeah.
Yes. So we don't, but there are lots of actually urologists and lots of doctors that are specializing in it. And I think, like you said, work on the confidence. And you don't, just because God made something that way does not mean we have to live with it anymore. I think there are so many cheat codes. And I think it is A-okay if you find a good provider that knows what they're doing and is going to put your health and safety first
Absolutely.
above your wants.
Yep.
I think you can make magic happen.
Yeah.
At any age.
Yeah, absolutely. It's all about optimizing yourself in whatever avenue you want to, for sure.
Yep.
Being the best person that you are made to be, right? So,
Well, cheers.
cheers
Thank
to
you
that.
for coming on and
Yes,
sharing
ma'am.
all that information with us.
Oh, thank you for having me.
Anytime.
Disclaimer. The information provided in this podcast is for educational purposes only and is not intended as medical advice. Please consult with your qualified healthcare professional to determine the best treatment options for your individual needs. Results may vary and all procedures carry some level of risk. Always make informed decisions in consultation with a licensed professional.